I'm going to be presenting on Dr. Anthony J. Bloom. Just so you guys know, my presentation kind of goes with Tasha's because she's doing Dr. Anthony Bloom's wife, who's also Dr. Bloom. But anyways, okay. I don't know why it's not going. So he's 6 years old. He's a UTEP psychology professor. He is concerned about knee pain that occurs sometimes when using the stairs. Also during COVID, he worked from home. His office was like right next to the kitchen, and thus he ended up gaining weight. And in his opinion, this puts more strain on his knees. So he does have a goal to lose weight. He can easily navigate his one-story home where he cooks dinner usually and splits chores with his wife. He's been married over 30 years. He has two adult children outside El Paso. He walks his two dogs daily. His prior jobs included being a researcher and a waiter. And his favorite occupation, in his words, is sleeping. He never has trouble conducting this activity. And in fact, when I asked him to come up with a wellness goal, he said he would like to sleep more often in more locations and in new positions. His medical and surgical history includes a pulmonary embolism at age 44. It took him a while to, it was at our second visit that he revealed that to me because I showed a concern about his high blood pressure and that this can lead to a stroke. He said, "Oh, well, I had one, but now they have me on blood thinners." And he believed that that would prevent any further embolism. So I had to do a little bit of education on like there's hemorrhagic strokes as well as the ones from a blood clot. So thus, we see that he has hypertension, intermittent knee pain I've mentioned. Also, when they did an MRI of his knee, they found a very narrowed space between his femur and tibia. And his doctor let him know this could be congenital, that his mother had a similar issue with her right knee as well. And it could also mean that the cartilage is wearing away. He also has bradycardia and fatigue. He supports generosity. Sorry, his supports include generosity, kindness, decency, and compassion. He says that his gray hair is a support because he believes it makes people think that he's wiser than he is. He's also not afraid to advocate for himself, so he calls the help desk almost daily asking for help with technology issues. And he enjoys walking his two dogs, which helps get him out of the house and get him more active. Some personal barriers include he has a little bit of trouble prioritizing tasks and making sure he gets everything done in a day that he wants to. Also, he didn't report this, but I noticed he doesn't visit his doctor as often as he should. For instance, although his two blood pressure medications aren't working as well as they could, he hasn't seen his cardiologist in almost a year. And he mentioned that he might need a new glasses prescription, and yet he hasn't seen his ophthalmologist in several years. Sociocultural supports include that he's married with two children, he has a stable, well-paying job. He's from Orlando, Florida, which he described as a sauna, and he said that this makes him really appreciate El Paso more because he enjoys the dry air and it helps him breathe easier. And he said a lot of people that he knows kind of undervalue El Paso in his opinion. But comparing it to where he lived before, he said El Paso's his favorite place he's ever lived. Some sociocultural barriers include not speaking Spanish in a primarily bilingual and Spanish speaking city, as well as he is self reported not very sociable and doesn't really like to socialize. Um, but he feels like this doesn't limit him, but due to work expectations, it might cause some barriers that he doesn't realize or doesn't think about. Physical supports include that all the campus computers work. He does teach statistics, and he says like there's many new stats programs that are much more effective than the older ones. Many new ways to display information, such as through videos. He likes how El Paso cools down at night and how beautiful the mountains are. It helps encourage him to go outside more. He applies sunblock every day to prevent skin cancer. And the fact that he has a one-story home with no stairs is good since they can cause some knee pain on his right knee. Some barriers include that the psychology building is very old, and in his words, the elevator rattles a lot, which scares him. He doesn't like to use it. His office is on the second floor, so he does end up going up at least two flights of stairs a day. Although going down the stairs is when he is more likely to have the knee pain. And there's no water fountains on the floor, so that also includes more walking, more using of the stairs. And the dry El Paso air He likes breathing it, but he does have to apply chapstick more often because of it. For evaluations, I administered the mocha. He scored perfectly on it. He needed no cues, no reminders when it came to remembering what he needed to remember. Cardiopulmonary, here's where we see a little bit more issues. His blood pressure was 149/99 while on two blood pressure medications. And when I asked if he has any trouble ever remembering to take the medication, he said no. He always takes it every morning and he's very good about his routines. Um, his pulse was 59, a little bit low. He showed no shortness of breath during testing, but reported that after climbing 2 flights of stairs, he usually does feel short of breath. For sensory, I focused on vision since he did say he might need new glasses, but his visual acuity was perfect, 20 out of 20. However, accommodation as the target got closer to his nose was impaired. It became unclear at about 8 inches from his nose, as well as his peripheral and temporal vision are limited to about 60 degrees instead of the norm, which is 85 to 100. And then for pain, it's relatively low, a 14 out of 78 on the McGill Pain Questionnaire modified, with traits of flashing, stabbing, sharp, pinching, and penetrating. He said it's brief and transient and only occurs about 15% of the time when using stairs, usually happens going down the stairs. For neuromuscular, he got a 0 on the Rosso and Breslau scale, which indicates full functional mobility. Then he completed the short physical performance battery. And for balance, he had a 4, indicating no issues. Gait speed was a 3, which is intermediate. The chair stance, he refused to do those, so it was a 0, leading to his total score 7 out of 12, indicating minor impairment. But taking that with a grain of salt, considering that he didn't feel safe doing the chair sit to stance portion, not due to balance or anything, just because he was afraid it might put a strain on his knees. So I'm going to talk a little bit more about that later. He had full functional range of motion on his upper extremities. His tug score was a 10.77 seconds. While this is below the fall risk level of 12 seconds, it is above the average time for his age. And in the functional reach test, he did well. He got 16.1 inches, which is greater than the average 14.9. Oh, and in the tug, I did write down that he did show some qualities, leaning forward, short strides, and not moving his arms very much while he walked, which, as we've learned in our classes, is not a great sign. Okay, so for ADLs and IDLs, he showed full independence in all of those. He did the CATS, the Lawton-Brody scale, as well as the kitchen task assessment. He got full independence. For the interest checklist, he showed interest in watching sports, cooking, reading, pets, music, art galleries, and all core subjects. I also administered the satisfaction with life scale, and he got a 28 out of 35, which is relatively high and satisfied. The only parts that were a little bit lower were so far I have gotten the important things I want in life, and if I could live my life over, I would change almost nothing. And that could be tied back to how he mentioned he doesn't get everything done in a day that he wants to get done due to fatigue or prioritization issues. I also administered the fatigue severity scale, which was 3.5. It's at that point, it is showing some fatigue, but not indicative of depression or fatigue related conditions like MS. But I also administered the multidimensional fatigue inventory, and this one showed a higher score of 60 out of 100, which indicates significant fatigue. And he agreed with aspects that said fatigue interferes with physical functioning and that he's easily fatigued. I'm gonna try to summarize this quickly. I was trying to include what I thought was relevant to my evaluation summary. So having blood pressure at 149/99 despite two blood pressure medications is nearly resistant hypertensive, which is when you have three blood pressure medications and are still hypertensive. Thus, in these instances, implementing lifestyle changes is greatly recommended along with modulating the medication because obviously that person is not responding as great to medications. A pulse of 59 indicates bradycardia. This can explain why he experiences some of the fatigue during activity and can make things like climbing stairs, walking long distances very tiring and necessitate frequent breaks. Excuse me. His deficit in accommodation and peripheral vision can hinder many occupations like driving. He'll have to turn his head laterally in order to make up for that loss of visual field. With poor accommodation, he can have trouble doing things like focusing on the speedometer and then cars far away. It might take him longer to adjust his focus, and also trouble noticing and responding to changes in nearby stimuli. So this honestly does present a little bit of a safety concern as far as some occupations like driving. I did recommend to him that he should receive further testing from his ophthalmologist for glaucoma, as glaucoma can be indicated by those two symptoms, along with other symptoms. His pain was relatively low, and upon further questioning, I did find that he has been avoiding the knee pain for months by slowly traversing the stairs while holding the rail. So this indicates that his knee pain is not really hindering his daily activities, unless, as we saw in the chair sit to stands, he thinks that this activity might strain his knee. He has full range of motion, no balance issues, intermediate gait speed, which is a little bit of concern, but he refused the sit to stand, like I mentioned earlier. This can indicate he has greater difficulty than he revealed completing occupations that require stooping and kneeling, such as cleaning the floor. Um, because if he does feel like it might cause the knee pain, he'll be likely to abstain from that activity. So, and then also the tug score, although he was under the 12 seconds, I did recommend that he should get preventative interventions for gait speed since his time was above the average for his age. He reported full independence, but like I mentioned earlier, he also mentioned severe fatigue and um, a lot of worry about straining his knee that contraindicated his um, his full independence that he claimed. Um, it can make it the fatigue can make it challenging to pace, continue, and accommodate activities. And in conclusion, I believe he would benefit from OT for lifestyle changes for hypertension, potential accommodation, vision therapies once glaucoma has been ruled out, joint protection strategies, occupational exercises, and energy conservation and prioritization. Three areas I wanted to focus on included the hypertension. He did admit he eats snacks high in sodium right now, 7 out of 7 days of the week. He did kind of say he kind of blamed his daughter because he said right now his daughter and her wife are staying with them, and that they were the ones who brought the snacks in to their home. And so he says it will probably get lower once they're not staying there. His gait speed could be improved, and then his high levels of fatigue. So the first goal focuses on integrating aerobic activity into his daily routines to work on fatigue, knee pain, blood pressure, and overall well being. So I talked about brainstorming previous active occupations to help find something meaningful for him, as well as identifying aspects of the environment that he can modify to make sure that he adheres to this aerobic activity consistently. The second goal focuses on the dietary changes that we want to see. So I said reducing processed foods high in sodium to 1 out of 7 days of the week. I thought saying never eating any salty foods in again would be rather unrealistic. Finding healthy food replacements to his favorite foods is one short-term goal. The other short-term goal is about tracking his abstinence from high sodium foods using a checklist. The third goal focuses on the prioritization and getting done what he wants to get done in the day using energy conservation and or prioritization techniques. So the short-term goal, oops, can't see it that well. He'll identify two energy conservation techniques to assist in completing daily activities, and then identifying 2 to 3 priorities at the start of each week and completing them using the energy conservation techniques he identified the week prior. My 3 interventions includes walking his dog, but making it a little bit more challenging for him by doing it on outdoor walking trails, creating healthy cheese puffs to replace a favorite snack of his, and diaphragmatic and pursed lip breathing in order to improve fatigue and help him with energy conservation. This is a flyer made that covers overall all of the interventions I brought up briefly, as well as I found research saying that it's very helpful to have a support system and an accountability program to help make sure that you implement these lifestyle changes. And I talk later about some different sources that he has for that. Okay. So this is my first handout. I made sure not to call it hiking because when I asked him if he has an interest in hiking, he said that that's too much work at his age. But there's many trails in El Paso, like the one I suggested here, the Lost Dog Trailhead, that are described as being easy, good for beginners. They aren't too steep of an incline. And so some people may or may not consider that hiking. I called it trail dog walking to help it be more appealing to him and to reimagine your typical dog walking experience. And I put why is because aerobic exercise such as this improves well-being. With gradually longer and steeper trails, he can enhance his endurance and fatigue and knee pain, as well as being in nature also enhances well-being. Research has shown he can do this with family members so they can work on their health together. For materials needed, I hesitated to put hiking boots, but it will be uneven terrain, so he may need those for safety, a hiking stick, harness, the dog water bottle. You can't forget that. Your dog needs to drink water too. I mentioned before the easier trails. He can use an app called All Trails to find dog-friendly trails near him. He can make this easier if need be by taking longer or only walking part of the trail. And then some safety concerns includes wearing a hat, sunscreen, carrying a water bottle, and hiking at dawn or dusk to avoid heat stroke or dehydration. This is my rationale. It included a study on exercise with strength and aerobic portions. Also, in this study, they found that treadmill activity helped improve the tug assessment, which I do have an interest in for my client. The next intervention is creating the healthy cheese puffs, like I mentioned. It's pretty easy. I put the steps right here. Um, it's just egg whites, cream of tartar, and basically shredded cheese. He can make it easier by asking a family member to help set it up for him or remind him of when to do it if he needs that little extra push. And oh, how to make it more challenging and make it healthier. This is a great recipe where he can put powdered fiber, powdered magnesium, potassium, and I'm bringing the other one right now. He can add minerals that can also help lower his blood pressure. So this is my rationale since he enjoys cooking and already knows he likes cheese puffs. Also, I had mentioned in the handout about finding an online accountability program to help him implement these changes. The research has found that weight loss, exercise, high fiber, low fat, low salt, as well as an increase in potassium, calcium, and magnesium, all can help lower blood pressure. And down here, you can see this is the nutritional comparison of a normal store-bought Cheetos and the healthified Cheeto recipe that you saw. And it's lower than a third of the calories, a third of the fat, more protein. It doesn't have any fiber, but we can always add powdered fiber. The third intervention is deep breathing, and in particular, pursed lip and diaphragmatic breathing, which I explain how to do here. It doesn't involve too many materials. The only safety concerns might be making sure you have a steady chair and breathing at a slow enough pace to avoid hyperventilation. So you want to aim for about 6 breaths per minute. I also brought up some energy conservation tips for him and ways to incorporate it into his daily routines. The reason for this was based on a study doing those kinds of treatments with the breathing techniques and also 2 minutes of relaxation in between the pursed lip and the diaphragmatic breathing. They saw decreased fatigue and daytime sleepiness. Then for my local and online resources, I think this would be a great one for him, the YMCA's blood pressure self-monitoring program, because it involves a healthy heart ambassador who keeps up with him on measuring his blood pressure at least twice a month, attending consultations, and monthly nutrition seminars. And while he doesn't have much interest in increasing his socializing, this is just strictly an accountability partner just to talk about his health. So I thought this is a good program for him. All Trails, that I mentioned before, can help him locate the best dog trails in El Paso. And then I recommended an app called Breathe Plus. It's free to start, and then certain features that you add on can cost a little bit of money. And it has deep breathing exercises, guided sessions, and a breath cycle counter. And that's my references. All right, thank you very much for listening to my presentation.